I have cancer. I'm alive, so technically I'm a cancer survivor, but that's not who I am, and I refuse to label myself like that. About 15 months ago, my head did not feel right, and I went to my primary care physician. He palpated my liver. I'd really like you to go get an ultrasound. And I was lying on the table and saw most images, and then in one image I saw a beautiful sphere, and I knew, I said, well, that doesn't belong there. About 15 months ago, I was diagnosed with neuroendocrine tumor of the pancreas.
And I was a mess, because I thought, I have you for a month, and only a month.
It is a unique category within malignant tumors, and you really have to understand the biology of the cancer and to understand what the patients have gone through over the course of the last several years. They may or may not have been diagnosed at a timely manner because of nonspecific symptoms, or maybe even misdiagnosed.
When you get a diagnosis, you don't know what that's going to entail, and the possibilities of the diagnosis are enough to be thinking about, as well as your spouse or partner. And so the question is, what do I do next?
A multidisciplinary clinic really brings together all physicians and other providers that are related to the treatment of a patient and puts the patient in the center. What patients get to do is to see multiple specialists in that same day and other multiple supportive care services, but then leave with a consensus of exactly how to treat their particular situation and a peace of mind going forward about exactly what the treatment plan is.
This guy isn't telling us one thing and this guy's telling us something else. They're all telling us the same thing based on best practices at the hospital, and that's really comforting to know.
Because we're a leading research institution, patients may have access to innovative trials or other surgical or interventional radiology techniques that may not be available in other places.
Someone said, "You don't look sick," and I said, "I'm not."
Yeah, no.